Battling COVID is difficult for some. The recovery process can be long and unpleasant. News Channel 12 reporter Patricia Martellotti joins us live to share what happens afterwards.
Workers here at Marian deal with the sickest of the sick. When COVID patients reach this level, the future can be frightening, and rehabilitation can be a long and difficult road. Physical therapist Paul Aravato gets ready to make his rounds among recovering COVID patients.
Our CCU is quite inundated with COVID cases, and the recovery of these patients is back to where we were with the last 2 rounds.
As he works with patients ranging from mild to critically ill, Aravato says some people have been intubated for several weeks.
Not being able to breathe, on high levels of oxygen, and barely can get out of bed. And I don't see this slowing down, so encourage people again to get the vaccine, to wear a mask, be socially distanced.
Health experts say some of the long-term effects can include difficulty breathing, heart palpitations, and scarring in the lungs.
If they are one of the few and lucky to survive, the rehabilitation process is a very long one. It's extensive. These patients have been in bed for some up to a month.
Other severe cases include patients still needing oxygen, even after leaving the hospital.
Some people have taken over a year to completely recover, if they do completely recover from this. So it's not just surviving it, it's rehabilitation after is very extensive.
I've seen the devastation it's caused, ranging from just minor shortness of breath with simple tasks to even death. And if this can be avoided, it shouldn't be that big of a deal.
I asked Paul Aravato about those not vaccinated, and based on what he's seen, he calls getting the shots a no-brainer. For now, live in Santa Maria, Patricia Martellotti, News Channel 12.
Patricia, thank you very much.